Morning everybody. Hope everyone's had a nice weekend. So we've only got one patient on our trauma list today, which is very good. So I think we'll just talk about them after we've done our introductions, if you're alright with that, Sarah, and then we'll complete the rest of the safety huddle, yeah? So Heather, scrub team lead.
Matt, orthopaedic registrar.
You an anaesthetic training.
Sarah, anaesthetic consultant.
Dean, anaesthetic ODP.
Kirsty, anaesthetic nurse. Corey, student ODP.
Joanne, scrub. So today's patient is Sophia Smith, an 80-year-old lady who fell yesterday, I heard, and sustained a neck and femur fracture with which she's undergone an ETS. Matt, any from you?
So it's going to be a left hemi, it's ETS with G and C. Do we have a range of sizes available?
Yes, so Joanne's checked in this morning that we have a full range of implants available.
Superb. It will be left side lateral approach, it will be standard closure. From the anaesthetic side, if I can have some augmenting and TXA if possible.
Okay, sure. The other thing is we'll need arm gutters, so when we do the prep, position-wise, we'll need an arm gutter. So this lady, frail 80-year-old, currently being investigated for chronic cognitive impairment. She has hypertension, CKD, she's on a diuretic, she's got COPD, which is well controlled. She's mobile about her own home, no allergies. I've given her an ASA3, but it will probably be a generous ASA3. In terms of us, I'm planning a spinal for her because of her COPD and blocks. We'll give her augmented and a TXA in the anaesthetic room when Matt, you come into position. If we can get her cannula on the left hand, because that will be, she'll be left hip up, and then the hand will be in the gutter, just so we get better flow with the drip. She's quite high risk for bone cement implantation syndrome.
Would you like to discuss?
Should we discuss that now and then finish the huddle?
Yeah. So obviously, Sarah, you're our lead anaesthetist, so we'll liaise with you. Matt will obviously, a few minutes before we get ready to cement, we'll ask if you guys are okay, if that's all right.
Yeah.
Is Ewan going to be your helper, or are you going to be in
my lead
theatre?
man.
Are you going to be in theatre, or?
I'm supervising in Theatre 3 as well, but between us, we'll communicate. Matt, just be really loud because I'm a little bit deaf. We've obviously got the drapes and you'll have your hood on, so just be really loud for me.
So Ewan, obviously, you're going to be doing, if you need to put lines in, etc., you'll just have to let us know. Anaesthetic practitioners, we've got Dean and Kirsty today, so I'm sure one of you will be in getting the drugs, etc., set up arterial CVP lines if needed, will administer cardiac arrest drugs under the guidance of the anaesthetist if required. Matt, you'll stop operating. We'll all help to turn the patient onto the back if that's what Sarah and Ewan require. We've got the IABAN ready to be opened just to cover the wound prior to flipping onto the side, and we'll take turns doing CPR as led by the guys at the top. Joanne, would you be able to call for help? Also help us turn the patient, record timings, drugs and shocks if that's to be going to the full arrest thing. Corey, would you be able to open the IABAN quickly for us? Just throw it on the trolley and then be a runner as needed and required as well. And would you be able to get the trolley, the resus trolley from the crossroads, which is just outside the theatre?
Do you want that now? Or?
No, we'll get just in case.
Just in case.
We'll refer to that if we need to during
because
the...
we'll stick that back up, but if the guys at the top do say that the patient's starting to have a reaction or some other event prior to cementation, we'll re-look at the curfew and just reiterate that. Because was everybody happy with their sort of rules, etc.? Sarah, in that likely event that you need extra consultant assistance, is there anybody around as well?
So Des is doing emergencies in 37, Des Randall. So he's got, I think he's got quite an experience, I think he's got an ST7 with it.
Right.
So he would probably be my first go-to because he's very close as well.
So who would like to be responsible for getting Dr. Randall if they ask for extra help from the top? So is everybody clear about what we're doing for Sophia this morning? Yeah? And
yes.
then should we go through the rest of the brief?
Yeah.
So we've all know each other, we have no staffing issues today, and no equipment changes, no list order, because we're lucky today, we've only got one
You're just
patient.
with us this morning on
this,
this.
and then we'll have a different team this afternoon. We should run to time this morning. Blood lossing units ordered and available if needed.
Yes.
Yes. Imaging is available. Operating table position is there. Sign out and time out will be done. It's Dr. Russ and the lovely Ewan this morning. Anaesthetic safety checks complete.
Yeah, they're complete.
We've talked about what you're going to do anaesthetic wise. We've talked about your concerns over the ASA grade in regards to cementation. We'll delegate scrub duties to the team. We'll have lunch after Sophia because we've only got one lady. We should run to time. Any issues regarding recovery? And no bed issues from the ward that we've heard. Thank you very much. So is everybody happy, and we'll just crack on with the send for Sophia? Thank you very much. Thank you.
Thank you.